Hi, my name's Dr. Sarah Moore and I am an integrative GP obstetrician. This is the second video in my pregnancy series, and in this video I will be covering the first trimester, 5 tips for surviving the first 3 months of your pregnancy. So in this video I am going to be talking about how we manage the symptoms of the first trimester, how to choose a daily self-care practice, the importance of booking in to see your GP for a medical review once you fall pregnant, beginning an antenatal education program, and also thinking about the model of care that you would like for your pregnancy. So to begin, let's talk about the symptoms that you may experience in the first trimester and how to manage them. So there's lots of common symptoms that arise in the first trimester, and they include lethargy, nausea and vomiting, reflux, pelvic pain, and bleeding. So there are lots of simple, natural ways to manage your symptoms, and most importantly, diet is a really important one. And we talk more about this in our Happy Healthy Mums and Bubs program, which is an online program that I have put together with Sally Gray, a naturopath, which you can find more information about on my website. There's some other nice natural remedies such as ginger, vitamin B12, and also some light and gentle exercise can be really important and helpful. Sometimes we do need to go down the pharmacological medication route, particularly if nausea or pain are an issue for you. But I would encourage you to consider some complementary therapies such as acupuncture, osteopathy, physiotherapy, chiropractic, naturopathy, and kinesiology, because they can all provide really helpful support with your symptoms in the first trimester. So moving on now to choosing a daily self-care practice. This is something I really encourage all of my pregnant women to do. Starting a regular practice such as mindfulness meditation or self-hypnosis can be incredibly helpful at this stage of your pregnancy, and it will actually help you in your preparation for your labour, your birth, and the postnatal period. There's a whole range of applications for your iPhone or your Android that you can download, and these will help guide you. I would also recommend reading the book Mindful Birthing by Nancy Bardecki, which is an excellent guide for practicing mindfulness in preparation for your labour. And also the Happy Healthy Mums and Bubs online program, which again you can find on my website. Once you're pregnant, it is important that you book in with your GP for a medical review quite early on. Your GP will review your medical history, identify any issues that might be relevant to the management of your pregnancy. They will conduct a mental health assessment, and that's really important because if you have got a history of anxiety, depression, or another mental health condition, it's really important that we get on top of that early to prevent any issues later in the pregnancy. We will do some testing, such as a dating ultrasound, some blood tests to check your blood group, make sure that you don't have any active infections, check that you're not anemic or iron deficient. And we also will offer you prenatal testing for chromosomal abnormalities and neural tube defects. And we do often discuss whether or not you'd like to be vaccinated against influenza. The next point will be thinking about your antenatal education program. Now, there's a range of different education programs online in the form of books and also face-to-face. I would really recommend that you do enrol in an online education program, and the one that I obviously would recommend is the Happy Healthy Mums and Bubs program, which I've put together with Sally Gray. It's an 8-week self-paced program, and it's been specifically designed for mums-to-be to support them with preparing their mind and body for pregnancy, birth, and beyond. So please visit my website, drsarahmoore.com, for more information and how to register. The other important thing for you to think about is the model of care that's available to you. So I work collaboratively with a team of GP obstetricians and midwives at my practice, and we see women antenatally and postnatally. The GP obstetricians in my town provide a shared on-call roster at our local hospital, which is a public hospital. So it means that I might not be the doctor that attends your birth if you go into labour on a day when I'm not on call. But I do trust that each of my colleagues will provide excellent women-centred care in collaboration with the midwives at our hospital. Other models of care in my region include privately practicing midwives who offer a home birth or hospital birth. And there's also public hospital specialist care at Bunbury Hospital, as well as private specialist obstetrician care at the private hospital in Bunbury. We're also in the process of setting up a publicly funded community midwifery program, and this offers continuity of midwifery care throughout the pregnancy and birth. And we do anticipate that will be available to women in the region sometime in 2018. So in summary, there's a number of options that you can choose to manage your symptoms in the first trimester. I would really recommend starting a daily self-care practice such as mindfulness meditation, which you can continue on in the rest of your pregnancy. You will need to book in to see your GP for a medical review and some initial testing. Please consider starting an antenatal education program such as the Happy Healthy Mums and Bubs program, and do think about the model of care that you would like to engage in for the rest of your pregnancy. So please remember my website, drsarahmoore.com, and if you like, please subscribe to my blog, This Doctor's Life, and you'll receive some great information on a monthly basis. Thanks for listening.